Good afternoon. Good to see you all here today, appropriately socially distanced. For those of you who don't know, to my right is Melissa DeRosa, Secretary to the Governor. To my left is Robert Mejica, Director of the Budget. Always happy, always smiling. Today is Sunday. It's a beautiful day in New York City. Sunday for me is a day of reflection, and we'll do a little reflecting. Today is day 64 since we closed down New York. Only 64 days. Feels like a lifetime, but only 64 days. Today's numbers. The total hospitalization rate is down, and that is good news for all concerned. 9,786, below 10,000, which is a big deal for us. You have to go back to like May 18th and 19th to see where to get near that number. March, I'm sorry. The number of total hospitalizations again is down. The number of intubations is down, and that's really good news because intubation is generally bad news. The number of new cases is 789. That's good news. We were hovering at about 900, 1,000. That may be just a reporting anomaly because this is over the weekend, and the weekend reporting tends to be a little different. And remember, this reporting system we just put in place. This never happened before, where hospitals were reporting on a daily basis. So, and hospitals have a lot going on, so I wouldn't bet the farm on any of these specific one-day numbers, but the overall trend is good. The number that is the most important number that we look at, which is still tremendously distressing, is the number of deaths, 280. And you can see that that number has not moved dramatically in a relatively long period of time. But the overall direction is good, even though it's very painful. I think it's important that we take a moment and learn the lessons of what we've been going through. This has been unprecedented, what we've been doing for the past 64 days. This was all an urgent situation. This was all hurry up. We had to quickly figure out a plan, quickly enact a plan. But now we're a couple of months into it, and I think simultaneously we should be learning the lessons of what we just went through. People talk about this like it's going to come and go and it's a once in a lifetime. I don't know that it's a once in a lifetime, and I don't know that it's going to come and go. There are people now talking about a second wave. They're talking about a possible mutation of the virus. So caution would suggest that as we go through this, we learn at the same time to make sure if we have to go through this again or if this is a prolonged situation, that we are learning from what we're implementing. Edmund Burke, great Irish philosopher, those who don't know history are doomed to repeat it. Wise words. The macro questions, bigger than just New York questions, bigger than the governor's questions. What happened in China? You know, people are talking about it. Where did this virus start in China? How did it start? How did we not know? What should China have told us? Above my pay grade, but important questions. How did the virus get from China to the United States? And we assumed it got on a plane from China and flew to the United States. That was the first thinking when this started. Now it appears that that's not so. As we're going through this, what could we have done differently? More importantly, what should we do differently if this is a prolonged situation or if there is a next time? And again, caution, I would assume there's a next time. Anyone who sits back and says, well, this is the only public health threat that we're going to face, it's not the case. We're seeing increasing threats all across the board, environmental threats, Mother Nature, natural threats, threats from emergency weather that we've never seen before. And if you look back, as far back as 1918, when they had the flu pandemic that people talk about, it took 10 months. It came in 3 different waves. And the second wave was worse than the first wave. So even if you put aside all the modern day challenges, when this happened in 1918, it came in 3 different waves. So let's be prepared and intelligent. Some of the lessons to learn, the CDC did a fascinating report that it put out on May 1, which starts to take a deep look at what happened. And I think there's a lot of important information in that. And it pointed to something that we've been looking at here in New York. The report says that when they look at the different strains of the virus in the United States, that there are different strains. And we were all looking at the West Coast. The West Coast had cases well before the East Coast, remember. Maybe 6 weeks before the East Coast. Those strains came from China. What we saw in the state of Washington, what we saw in California, they came from China. Flights from China land predominantly on the West Coast. What we have seen in New York didn't come from China, but actually is a different strain of the virus that came from Europe. That's an important fact to know and to study. They then said in the CDC report, from February, you had 139,000 travelers coming from Italy, 1.74 million from other European countries where the outbreak was spreading wildly and rapidly. So everybody's looking at China. Meanwhile, the virus had traveled from China to Europe, was in Europe, spreading from Europe. We had European travelers coming. They come to the East Coast. They land in New York. They go to New Jersey. They go to Connecticut. They're in the New York area. And we're all still looking at China. We were looking at China, and the travel ban on China may have been helpful, but the horse was already out of the barn in China. The virus had left. The virus was in Europe. And meanwhile, we have European travelers coming here, and they're bringing the virus, which is now a different strain of the virus, to the East Coast. This is from that CDC report. The deputy director, principal deputy director, delaying travel bans allowed for the virus to spread throughout the United States and contributed to the initiation and acceleration of domestic COVID cases in March. Extensive travel from Europe, once Europe was having outbreaks, really accelerated our importation and the rapid spread. The timing of our travel alerts should have been earlier. That is a very important fact and something we have to learn from. Person from the Grossman School of Medicine, knowing the number of flights coming into New York from Italy, it was like watching a horrible train wreck in slow motion. Nobody was watching Italy and Europe at the time. Nobody was even thinking about it. Today we must consider an outbreak anywhere is an outbreak everywhere. A.J. Parkinson. And I think those are words to remember going forward. Outbreak in China. In a number of days it's going to be in Europe. From Europe it's going to come to the United States, assuming it didn't come from the United States immediately from China. Another lesson we have to learn is our hospital system. You know, we talk about our hospital system. We don't really have a public health system. We have a hospital system. And we learned the hard way about the capacity, the equipment, and the management of our hospital system. New York City, we have only 12 public hospitals. They are the Health and Hospitals Corporation. They're run by New York City. But there's only 12 hospitals in that public hospital system. 44 hospitals are private hospitals. They're private institutions. They're regulated by the state, but they are private institutions. They have their own area of expertise, they have their own basic clientele, and they're doing business as individual entities, like an individual college, right? We have a system of colleges, but each college is individual. It's the same thing with hospitals. Each hospital is an individual entity. Long Island, we have 4 public hospitals, but we have 19 private hospitals. Westchester, 1 public hospital, 12 private. Rockland, 1 public, 2 private. Hudson Valley, rest of the state, 2 public hospitals, 87 private hospitals. So really, your healthcare capacity in the state is all in the hands of private hospitals, right? You have 176 private hospitals in the state. That's the capacity. But that means you have to now rely on those private hospitals, get them all to be part of one system, which day to day, that does not happen. They're operating themselves. We have, again, state regulations that say this is how much you must operate. But they operate as individual entities. In the middle of this outbreak, we had to go back and do what we call the surge and flex management system, where we said to all 176 private hospitals, we have to work together. And we have to manage this system as one, because hospitals are getting overwhelmed. Maybe within the public system, they can share patients and doctors and staff, because you have, in New York City, H&H has 12 hospitals. Okay, you can share among your 12, but we have to get these 176 hospitals now all to work together, even with the public hospital. And hospitals were getting overwhelmed. So now you need a system to share patient capacity, share equipment, share ventilators, share staff. That had never been done. We did this all basically on the fly, and we put together a de facto public health system. But it was a lot to do on the fly, and we need to institutionalize these lessons. Part of what we have to learn is what happened with the equipment. I mean, this was just a situation that nobody anticipated. It happened all across the country. You couldn't get enough gowns. You couldn't get enough masks. We're going to put in a state requirement now that every hospital has to have a 90-day supply, stockpile, their own stockpile, of all the PPE equipment that they could need for a 90-day supply at the rate of usage that we saw with this COVID virus. So every hospital has to have 90-day supply, period. We can't go through this day-to-day moving masks all across the state, right? This mad scramble that we were in and still are in many ways. Also, as a nation, we can't go through this again. There was competition among states. There were competition among private entities to get this equipment. The federal government was trying to buy it. I'm bidding on behalf of New York. We're bidding against other states, Texas, California, other states across the country are trying to buy the same masks from the same vendor. We literally wound up bidding up the price. Have people in China. I'm trying to contact people in China who can figure out how to buy masks from China. It was totally inefficient and ineffective. State of Massachusetts, Governor Baker was good enough to work with Robert Kraft, who had a personal airplane that he sent to China to get masks. And Massachusetts was good enough to give us some of the masks that a private airplane picked up. I mean, this is not the way to deal with this situation, right? Plus, we just drove up prices by our own competition. There was a limited supply. It was primarily in China. And then you have 50 states and all these private entities and the federal government trying to buy from China. It made no sense. So let's fix that. New York State alone buys about $2 billion of medical supplies this year. $2 billion this year. And that's one state. And that's us purchasing from China and around the world. We're going to form a consortium with our 7 Northeast partner states, which buy about $5 billion worth of equipment and supplies. That will then increase our market power when we're buying. And we will buy as a consortium, price as a consortium for PPE equipment, ventilators, medical equipment, whatever we need to buy when you put all those hospitals together, all that public health capacity together, which will make us more competitive in the international marketplace. And I believe it will save taxpayers money. I also believe it'll help us actually get the equipment, because we have trouble still getting the equipment and just buying the equipment, because these vendors on the other side, they're dealing with countries, they're dealing with the federal government. Why should they do business with one state, right, when they can do business with an entire country? So this consortium, I think, will help us get the equipment and get it at a better price. We will come up with a regional identification of all the equipment we need. Basically, it's all standard equipment. A mask is a mask, a gown is a gown. Let's come up with a total amount that we need. Let's stop doing business with vendors who we found to be irresponsible, and we found out the hard way. I can't tell you how many orders we placed with vendors who were acting basically as brokers, who just started businesses in the middle of this pandemic because they saw an opportunity. So let's compare notes among the states to find out who was good to do business, who was not good to do business with. Let's see if we can't do the purchasing in this country, and let's see if we can't do the purchasing in this region. You know, why are we buying all this material from China? Literally billions of dollars of PPE. And we'll do it in coordination with the federal government. But I want to thank our neighbors, our neighboring states. The word neighbor has a different connotation. You don't normally think of the surrounding states as neighbors. You think of the person next door as a neighbor, but they are neighbors. And they've acted as neighbors. I can't tell you how supportive Governor Murphy in New Jersey and Governor Lamont in Connecticut and all the other governors in our coalition have been. Literally, where you can pick up a phone and I can say, I need help with masks. Do you have any extra masks? Do you have any extra gowns? Can I borrow this? Can I borrow that? Really, the way you would deal with a neighbor in an extraordinary circumstance, right? You'd knock on the door and say, can I borrow this? That's how these states responded. And it was really a beautiful, generous way of operating that was an inspiration to me. You know, it wasn't, I'll have my lawyer call your lawyer. It was, whatever I can do, I'll do. And in that spirit, we want to keep that coalition together.